It's now 8:24. Good morning. We're going to talk about the Great Yorkshire Show in a moment. But first, one MP in Bradford is warning that 2,000 people in the city could be left without good enough care if the council makes changes to the way it delivers support to vulnerable people. It's David Ward, the Liberal Democrat MP, with us now. Good morning, David. What's worrying you here? What's the problem?
Well, there are two things. There's what's happening in Bradford at the moment. There's a consultation on changing the level at which people are entitled to support.
These are vulnerable people, those classified as being vulnerable and needing help in the district.
They are, and the particular emphasis that I'm trying to make at the moment is the forgotten many, I nearly said few, but the forgotten many. 1 in 3 who are receiving care are actually below the age of 65. We're all aware of a growing population of elderly people and vulnerable and need care. But there are also 1 in 3 people who are receiving care who are actually under 65 but disabled. And they also, I think, their life experiences are curtailed, held back if they're not provided with support. So
why are you worried that support won't be there?
Well, yes, I am, because what the government is doing, proposing to do through the new legislation that's going through on the care bill, is to have a level which is the same across the whole of the country. And you can understand the need for that, so there's not this postcode lottery that everybody talks about. But if that level of need, the level at which you are entitled, is at too high a level, that will have a massive effect on many, many people. 2,000 you've mentioned in Bradford, but over 100,000 disabled people, let alone those who are elderly, across the country. Now, some research has been carried out by Scope, Mencap, or other charities with the help of Deloitte, which says it's actually a false economy, because if we can provide support to people at the moderate level of needs as it's defined, that means that there will be actually a saving. So 1.2 billion, I know it's a lot of money, but 1.2 billion will actually save us 355 million on the health service budgets, on the council budgets, and to individuals themselves.
But finally, David, the coalition government of which you are a part are asking authorities to cut their spending.
Well, as I'm saying, it's a false economy, and we have the spending review when the big decisions will be made on where funding should be. And what we're saying in this area, be very, very careful, because cutting back in this area will be a false economy, and there will be greater cost to the health service and to local authorities in the long run if we do not provide enough social care support at the right level early enough.
Thank you. David Ward, Liberal Democrat MP from Bradford East.